My name is Dr. Tyler Tolbert,
And I'm Dr. Soren Paape.
and you're listening to the Fix Podcast.
Hello, and welcome back to the Fix Podcast. We have on a very special guest, as they are all very special, but this one is a little bit more special than the rest. So this is Dr. Aaron Berger. He is someone that we've been working together with for quite some time, actually several years. But more recently, he has been working with us at Smile Now. Now, that's not something that we really get into a whole lot on the show, talking about working at Smile Now. But as time has gone along and we've seen people, progress through these clinics and have experiences in them, we found that a lot of the things that people are going through are very relevant to the experiences that people listen to this show for. So Dr. Aaron Berger is here with us today. He is our lead surgeon and shorter doctor at Reno, Smile Now Reno. And he's here to, talk about pretty much his entire full arch journey, take us kind of from the beginning up to now, and kind of walk through, what his story is like, how he got into full arch. He's an extremely proficient surgeon. I put his skills up against anyone else, and he's working in a somewhat challenging environment right now. And we'll kind of get into that. Yeah, Aaron, I just really appreciate you coming on the show and being willing to share your experience with everyone.
Yeah, appreciate that intro, Tyler. It's really great to be here. I've been listening to you guys talk for years now, so I'm excited to be on the show.
Yeah, absolutely, man. Soren, how are you doing, by the way?
I'm good, guys. Nice to see everyone again, hear everybody. It's been a minute. We always do these episodes in batches, so we'll like roll through a bunch in 1 month and then kind of tee them up. So it's been a little bit. Hopefully we're not too rusty, but I'm excited to hear Aaron's story for everybody. I mean, we know Aaron's story, but we're excited to go over it with everybody. So Aaron, if you want to just kind of jump in, I think a good start would just be, everybody loves to hear how, people get into full arch, what training they had beforehand, how they got to the spot that you are in now. And then we can go a little bit after we talk about your background into what a day-to-day looks like in Reno, how your progression from Cincinnati to Portland to Reno has been. But yeah, why don't you kick it off?
Yeah, for sure. So I think I had kind of a unique background because when I graduated dental school, I skipped residency, and that was against the grain for most of my class. I went to Columbia, where most of my classmates specialized or did higher education after dental school. And I was a long time believer that when I would graduate dental school, I would jump straight into practice ownership. And that did not quite materialize. I ended up working at a corporate dental group right out of dental school, and it turned out to be really heavy in surgery. And it was kind of funny because when I was in dental school, we weren't allowed to extract more than one tooth at a time. We had to have a resident come and do the case if there was more than one tooth and it wasn't loose.
So did you
I
guys,
definitely,
sorry to interrupt there. Did you guys never do any like immediate dentures or anything like that? No
no,
way.
never,
That's bizarre.
never. Columbia
I'm guessing-
was a specialty heavy school, so everything was just kicked up to the graduates.
Yeah, that's what they don't tell you in the dental school interviews. They're like, hey, you want to specialize? That's great. We have all the specialties here. Then you come to find out that means you just don't get to do anything.
It was
Sorry to
a lot of SRPs and fillings. So
Yeah.
I definitely did not have like the same surgical background that Soren had in dental school.
For sure.
Yeah, definitely. I definitely got lucky with mine, 100%.
I ended up working at a corporate dental office, and the practice did a high volume of dentures. And the guy who owned the group of practices was really passionate about implants. And he also funneled all the implant cases to himself too. So there wasn't a whole lot of like mentorship or training. I was kind of thrown into the mix, and within the first couple months after graduation, I was doing full mouth extraction, and I learned that I was very bad at that. And it was something I had to spend a lot of time refining, how to not struggle with a tooth that has more than one root. So, really that's like what kind of got me started learning more about surgery is how to do full mouth extraction, not only efficiently, quickly, cleanly, but also the rest of the basic surgical principles like making sure you have a clean alveoloplasty plane when you're doing an immediate denture, tori removal. So every day I really was focused on just getting 1% better. What is a new skill I could apply to this case today? And after about 6 months, um, I got to do my first overdenture case. And really, that's where I saw the difference that implants made. Just a two-implant locator denture case, and it probably took me 2.5 hours to do. But I really saw the power that implants had, and that's why I changed paths from like being all about business ownership to surgery is really fun and rewarding, and the patient outcomes are great. So that's kind of what kicked it off for me.
Yeah, I think all of us can probably resonate with that because I went through dental school and I was doing a podcast. It was all about practice ownership. I would literally like kind of talk to people who were already dentists and like talk them through practice acquisition and transition and all these things. And my intent from D1 through most of D2 and even partially D3 was that first thing right out the bat, I was right out the gate, I was going to start an office. I was going to acquire an office rather. And I had all the feelers out there, and I had spoken to many dentists about it, and I had a few, irons in the fire there. But I found out kind of through that third and fourth year that I really had a passion for surgery as well, and I was growing to learn about full arch. And I had the luxury of being out of school for about 6 months because I was a COVID grad, and during that whole time, I was, listening to podcasts about implants, reading books, zero bone loss concepts, all these things, and I found out that, oh my god, like I actually care about this, and I didn't really know that leading into it. I saw dentistry as, of course, there's all the dental school interview things with like, I love to help people and I want to be part of transformations and help people take care of their health, but I really respected the business aspect of it. So for me, implants was kind of this like really surprising thing that kind of woke me up to, oh, maybe I actually really like doing certain types of dentistry. And so, that's a big transition because I don't think anybody goes right out of school and starts a full arch practice. I think that would be pretty irresponsible. I mean, even if you have like all the experience in the world, like Soren, for instance, you know, there's just so many hard lessons that really have to be learned in the real world, and there's no dental school that can possibly prepare you for that. And so, it's kind of this trait. It's like, this identity thing that happens where you saw yourself as the solo entrepreneur that was going to go out and do this thing that very few people at that stage in their careers will do. And instead you kind of exchange it for another thing that's actually very similar in spirit, but it's really doubling down the clinical part and getting into the tools of the trade and focusing on that just 1% better thing and getting those reps in. And it's a very different journey, but I think the mentality is actually somewhat similar. So it's interesting that we've all kind of gone through that, similar path.
I think one thing that's like universal to excellent full arch doctors is the desire to continuously improve.
Always.
And for me, like really just diving deep into textbooks and taking continuing education and wanting every patient outcome to be better and better. And what can I do on my next case? And just continuously developing the skill set, like you were saying, really, I
Yeah.
think that naturally led me down the path towards full arch.
Yeah, I totally agree. And like the things that are most fundamental to having success in full arch are the sorts of things that you started doing in that first job, like an immediate denture. My God, like efficient extractions, being able to handle, a case getting bloody, being able to do a good flap, being able to smooth bone and do a good alveo like that. I mean, when we're evaluating doctors, like a lot of times um, either we'll shadow doctors in their practice or we'll see them at a course, or maybe they come into our practice and do some work. And we're watching them, or maybe they're working within their own practice, of course. There's many scenarios where we can evaluate people, but the things that really tell me how good of a surgeon that I'm dealing with and how this day is going to go are like right off the bat. It's like, how are they extracting these teeth? Do they know how to do alveo? Can they do a good flap? Like within the first 15, 20 minutes, like I have a very good idea what the outcome is going to be. And all of those things are included just in the immediate denture process. So you can start, I mean, a lot of dental schools will let you do immediate dentures. You can start even just there, getting that fundamental skill. So, you may have not known that your terminus was going to be being a super highly skilled full arch surgeon, but you were definitely taking the right steps to get there, I think.
Yeah, I'll piggyback off that as well because, um, and we've talked about this before on the podcast that one of the biggest and most important things to start is getting that foundational knowledge, right? Extracting teeth efficiently, um, you know, blood heme management, removing all of the teeth in an efficient way, doing proper alveoloplasty. And the thing is, like, it doesn't matter if you've been out of school for 1 year or 20 years. A lot of general dentists don't get that experience even 20 years out. Like, I'm sure if you went and talked to most GPs, they don't do a lot of full mouth extractions. They don't do a lot of dentures. So if you're able to get that experience in dental school, right? What I did, and it's different in every school, like you just kind of implied, Aaron, that Columbia or schools that kind of push people into more specialties, sometimes it can be a lot harder to get that experience. But if you're in one of those schools where you have that ability to get the experience, I would push you to just reach out to your clinical directors in those different, it doesn't matter what specialty it is, right? If you want to do endo or if you want to do more surgery or whatnot, but here we're talking about mainly surgery, but just tell them like, hey, I really want to get as much experience as I possibly can, because I would argue that you probably can get more experience in dental school than most general dental offices with surgery if you push yourself to that. And if you can come out of school with a good foundation, Tyler's right. Like, um, you know, coming out and going right into like a fixed office is pretty much not attainable, and I wouldn't recommend it. There's so much more to these offices than just taking out teeth, laying a flap, and placing implants. Um, Patient management is huge. Just doing the basic pros stuff in these full arch surgeries can be really, really difficult if you don't have the training. However, if you get that foundation in school, then you can target finding an office that will allow you to do those things. But also be careful at the same time, because there's a lot of clinics out there that say, oh yeah, you can do all the implants you want, but then you get in there and you quickly realize that maybe they're doing one implant every couple months and it's not really like that situation. But there's a lot of clinics out there that they like, for example, affordable, right? Like you're just doing extractions and dentures all day. And that's a great way to get a good foundational knowledge. And then once you're ready and you have that ability to just extract an arch in a reasonable time, lay a large flap, um, degranulate, do an alveoloplasty, well, then the implant side is relatively easy depending on case selection. I will say that I don't know about you guys, but cases are getting harder and harder. Like, I'm seeing patients that come in with wild stuff these days. However, just I think it's important building that foundation to just have proper case selection. Don't try to do something absolutely insane. And when you're ready for it, if you get in there and start getting in those reps, that's how you kind of get that initial ability to do these larger cases. So what you did was maybe not planned, right? But it definitely was the proper way to do things that whenever people ask me, what are the best ways to get into full arch? What you did is exactly that.
Yeah. So in the corporate practice, you're doing the media dentures, you're getting into some overdentures. Where does it go from there?
Yeah. Um, my first full arch experience was over the shoulder with Soren. And it was
I can't think of a better intro.
honestly, yeah, it was a really great experience. And I feel like, if it's preparation and experience, like you guys are saying, like if you're not putting in the work beforehand and spending time learning about the process, like you shouldn't be learning what a multi-unit is on your first day of surgery, right? You should come in prepared for surgery. You should know what to expect. That way you can dial in the finer details of your first case. And so having someone with experience like Soren for the first surgery was huge too. Like I wouldn't recommend doing your first fixed case solo. unless, you know, you have like years of experience doing implants and you've been to a lot of CE, but really like having someone over the shoulder is the best way to do your first case. And the really cool thing is, Soren's been present for multiple of my cases over the year. Like a lot of my clinical firsts, I attribute because I did them with Soren. Um, my first fixed arch, my first difficult fixed arch, my first FP1, first pterygoids. He was there for every experience. So
It's funny. I didn't realize that. I've still not actually seen you work in person. We've just
yeah,
been
I
going off
know.
of, Soren's, word.
But you've seen
That's
the
awesome.
post-op pianos.
That's true, and
Yeah.
they've been cleaner than pretty much any of my surgeries. So
And
No,
I
yeah, I
think
agree.
like
And that, go ahead.
I was just gonna say, like, having a mentor is invaluable, right? Like someone who knows you well. Like I've worked with Soren so many times, and I've also seen him work so many times. I've been to his office numerous times. Like I feel like if we had the same patient, the end result would be almost identical at the end of the course
yeah,
of their treatment because we apply the same principles. We approach every case in a similar manner. So really like having a good mentor and a good relationship with them is important.
Yeah, I agree for sure. I think that you are 100% right in the fact that getting the information is so important, and being ready to do every step of a surgery is really important as well. I see so many people that will do like mentorship based surgeries, but they don't come in prepared. And if you don't come in prepared, then it's really difficult to kind of like grasp everything that you're doing in a surgery. So like for me, before, my first surgery, right? I mean, I did a lot of cadaver labs. I did a lot of like live patient surgeries before I did my first one solo. But before I went into any of those cadaver labs, or before I did like a live patient experience, I I was up watching surgeries nonstop the days leading up to it, because I wanted to
really.
know. And another thing that you can do that I used to do before all of my surgeries was, on my way to work, every single step of surgery I would be going through in my head. You know, what instrument do I need to pick up? Like, how am I going to anesthetize the patient? What instruments am I going to pick up? What forceps am I going to pick up? How am I taking out all the teeth after I get the teeth out? How do I lay the flap? How am I going to do my alveoloplasty? And then when you get to the implant side, you're absolutely right. You need to know what a multi-unit is. You need to know how to properly place your multi-unit on the implant, and timing of those multi-units. And then after the multi-unit, like, what do I need to put on next? So going through all of those things in your head before a first surgery is absolutely critical, because what can happen is, surgery is overwhelming. Surgery is messy. There's going to be things that happen during surgery that you're not planned for. The patient's going to bleed, right? And like when the patient starts bleeding, all of a sudden stuff starts to get more chaotic, and it's really easy to forget those things. So going into this, any kind of surgery, or even going into watching a surgery, you will get so much out of those surgeries if you are properly prepared for that. Uh, and, I would advise people not to do or go to more advanced CEs until you get that good foundational knowledge, because like, don't go to a pterygoid course if you've only done 3 or 4 full arches, because what happens is, like, you don't pick up the little nuggets until like you have that good foundational knowledge. There's so many things that I learned from really good surgeons now that I've seen do surgery over and over and over again, that I just kind of breezed by because I wasn't really paying attention to what was going on, or I didn't really understand it. Even little things like, there's stuff I do in surgery now that I didn't do before. Like thinning out the palatal tissue, right? Like benefits of that, or like even in the beginning, just like ensuring that I was spending enough time to get good keratinized tissue around those implants, because you don't see those complications until after you do hundreds and hundreds of arches, or in clinical practice for years on end afterwards. because it's super easy just to stick some implant in and send their patient on the way. But what isn't easy is making sure those patients 5 years later have a good, successful clinical outcome. And if things are looking good at 5 years, hopefully they will be at 15, 20 years. But if you don't do that surgery correctly off the bat, then 1, 2 years down the line, you might be in a very different situation.
Yeah, I really agree with that. I really especially like the visualization part you talk about, Soren, because you if you read like sports bios or documentaries and things, and you notice a lot of like really great athletes, like they visualize a lot of things. I think I read a book by Tiger Woods, like when I was a kid or something like that, and it was either by him or about him, doesn't matter. But he talked about how like before he would go through a course, he would walk through the entire thing in his head. F1 drivers do the same thing. If you're familiar with Drive to Survive, stuff like that, they do it on the simulators. Like they've already done the race before they actually do it. And it's the same thing here because, like you said, I mean, there's so many things that are unpredictable. Surgery is unpredictable, and Murphy's law always takes precedent. And things will happen, but if you're at least 100% prepared for the things that you knew would happen, then that makes you a whole lot more prepared for the things that you didn't know was going to happen. And being able to walk through all of that minutia is so important. And I even think too, like when you're watching someone else do surgery, pretending that you're doing it, even if you're watching a video or something like that, and trying to sort of mimic it mentally, and making the motions with your hands and thinking through like, okay, exactly what are we going to do next? Or this just happened. How would I approach the very next thing? And then watch what the person does. Being that sort of active participant, even when you're witnessing something, is really important. And that's something you can do, from the very beginning when you're getting your first shadowing experiences before you ever even go to dental school. Starting to do that visualization practice is so valuable. And anytime I'm going into a case that I'm not super familiar with or trying a new technique, like that's what I'm doing. I am rehearsing mentally the whole time. It affects your sleep the night before, which can be an issue, but I think the net benefit is positive.
I think too, like having things you think about, like it's funny, like having done hundreds of cases now, I still think about the same things in my head every single case. Like I still remind myself every single day, like slow is smooth, smooth is fast. I'm not sure if you guys coined that or if that was maybe someone else said it, but I still think about those things, and the fundamentals really never leave you.
No, I agree. I totally agree. And that was the AOX blog that quoted that. And I think that he got it from somewhere else. But yeah, so you did your first arch. You got some experience under your belt. Can you talk a little bit about like your going through the prosthetic side of things? I believe when you started, right, you were probably analog. You kind of moved into digital. Why don't you talk a little bit about that experience? Talk about, what the benefits were to digital, maybe some difficulties you had during that, because I know that you went through a lot during that transition from analog to digital, from, using different type of photogrammetry units. Didn't you do like a partial digital workflow for a bit, working through different labs? I'd love to kind of hear your experience with that.
Yeah. And I think that relates back to what we were talking in the beginning. Like I had such a solid fundamental in removable treatment that going fixed for me, all it did was solve a lot of problems for patients, right? Like
Yeah.
having that removable workflow dialed in was so important. And those principles still apply in the digital workflow. It just expedites the process. And it's funny because I actually had a case this morning. The patient didn't bring her denture to the visit where we were getting scans done and doing an exam. And then she also forgot to bring them in for surgery today. And so I had to go back and do a mush bite. And all
Yeah.
I had was putty and a blade to mark the midline and a camera for pictures. And the teeth came out fantastic. And that's because the principles of VDO, CR, like all those things come into the equation, as well as having excellent designers you could work with. And really, like if you think about analog, it's, you look at an impression, you're going to inspect it and make sure you have good data. It's the same thing with digital. Just because it's on a computer screen doesn't mean you don't need to inspect that data. Tons of issues can happen with digital scanners. I'm working with a newer scanner now, the Serios, and I'm finding that it's fantastic. The only issue it has is sometimes it'll double scan. And so things like teaching the team to catch that. What does a double scan look like? What are the consequences of having a double scan? Things won't align well on the laboratory side and make things unpredictable for them. So really, like when it comes to the analog workflow versus digital workflow, it's all the same principles. And so being able to take a really solid alginate, right? Like making sure you're seeing the hammer notch, the tuberosity, the nasopalatine papilla, all the extensions, like you need to capture that anatomy in your scan too. So I think having a really solid analog background really helped jump into digital. And really, it wasn't too challenging. It was just learning new softwares, learning about different settings on printers and how that affects the quality, things like that.
Yeah, for sure. And I'm gonna actually quickly jump in and give people a golden nugget here because I think you kind of breezed past it. But essentially, I think what you were saying earlier was a lot of people will do like a big if a patient is a dentulous, the it makes it a lot harder to do to get a good surgical outcome if you don't properly plan your surgery. And what you can do, and what we do in my clinic is, we'll scan the patient in that VDO uh, with their denture in. So we'll basically do an intraoral scan of the teeth, upper lower bite. Then we'll take that denture off, scan it 360. And usually the lab can do a pretty decent alignment with the soft tissue scan, a denture scan, and then that denture bite. But the if you don't have that denture, then you can get into a sticky situation. So things that I've done in the past are, one, if the patient wants to get a surgery done quickly, you really don't need those scans. What you can do is after you place the implants, you place your scan bodies, you can do a wash under those. And I don't mean scan bodies. I mean the multi-unit healing caps, but you can do a wash with the multi-unit healing caps, and then place that patient into the VDO and then scan that in the mouth. And normally you can get a pretty decent VDO where the lab can align that to the soft tissue scan with those multi-unit healing caps on the implants. And then they can do a design based on that. However, if you don't have a VDO at all, that's when things get a little bit difficult. And you typically have two different options. Option one is what Aaron did, where he did basically a mush bite, setting the patient into the VDO and capturing those multi-unit healing caps in that mush bite, so the lab can align at least like a fairly decent VDO with that mush bite and those multi-unit healing caps. Is that what you did today? Correct?
Yes, I actually did a mush bite before surgery, marked midline, took a picture, measured the patient's vertical with the mush bite in so I could record that. And then I ended up placing fiduciary markers anyways.
Yeah. So that works too. There's a million ways to skin a cat, right? But that totally works. The other thing that you can do that, I've had to do on a couple occasions is if you're in a really tough spot where the patient let's say the patient comes in fully edentulous and you don't have any like a pre-op denture or a guide or anything like that you can use. Another thing you can do is you can just place fiducials on the upper and lower. Do your surgery as normal, take a post-op scan, and then you can have the lab give you a basic design that you basically know is going to be way off. But you print that quickly, don't characterize it at all, just put it back in the patient's mouth, grab the photos afterwards, do a post-surgical scan, and then just reprint it that same day. And that's another way to basically get a perfect bite on a patient that didn't have any kind of pre-op records at all. And obviously that's not something that I love to do. However, a lot of times with these patients, I will give them kind of I'll just set their expectations before that surgery starts and let them know, hey, you're coming in without any teeth and without a denture. So we really don't have a good VDO to start. And, maybe some dentists would go and make a whole denture for them and do the whole VDO process. And that is one way to do it. But a lot of these patients, they're coming into your office because they want to get teeth done now. And you don't want to push their surgery off a month because you're making them a denture. So, utilizing the tools that you have, and maybe it's going to take you a little bit longer on that surgical day to do two different designs. But if you're working with a really good lab, you can get it done, no problem. I mean, in my clinic, we'll do 4 arches, a double while doing that process. And the patient still, maybe they have to hang out for an extra couple hours. However, we end up with a great result every single time. And it's all just about kind of like utilizing the different tools that you have with digital workflows, and setting the patient's expectations properly to make sure that they end up with a good result. And it's not always perfect, but setting those expectations ahead of time, I think, is really, really critical. But so we talked a little bit about analog to digital. Why don't you talk a little bit about your experience with going from the past clinic you were in, doing some of the digital stuff, and then your move to Portland, why you decided to make the move to Reno, and then how your experience has been in the Reno clinic so far.
Yeah, for sure. So I was in Cincinnati for 2 years, and during that time, I transitioned from analog to digital, and honestly, that was pretty painful because most of my records were on master casts, and it was either digitizing them or just finishing them out analog and then starting new patients digital. And so, yeah, like what you were saying is some of the patients were kind of in that weird in between where you had to come up with a good solution to either digitize in their case or finishing them up analog. And really, like for me personally, I ended up just finishing up my analog cases as analog and transitioned all my new patients on digital. That way the records were complete from day one and there was no like lost in translation type of issue. And then so moving to Portland, really my fiance is from the West Coast, so we knew we wanted to move back out to the West Coast and set up shop here and start to build a family. So ultimately, leaving Cincinnati was purely for myself and my fiance and wanting to really love where we live. We ended up in Portland for only 6 months before this opportunity came available in Reno, and the Reno office has been really busy. So we're really happy we made that move. And what we learned about Reno is it's gorgeous. Tahoe is an hour away. There's mountains in our backyard. There's world-class mountain biking. They host, I think it's the Enduro, like cross country or XC championships. So there's really like world-class mountain biking in my backyard. And that's a really big passion of mine, as well as ski resorts that are 40 minutes away. So we've been really happy with the move to Reno so far, like pleasantly surprised. And I think we're going to be able to build a really great life here.
Great. Yeah. What about the clinical side of things? Let's talk about like, how many arches are you doing in Reno? What's the new patient flow been like? What other challenges are you facing in Reno? And I'll piggyback off of you because, I have my Reno license and I've done a lot of cases in the Reno clinic. So I know the ones that I have, but I'd love to hear a little bit about, maybe we'll start with the pros of the clinically, and then talk about challenges that you've faced in Reno that you haven't faced in other states due to like regulation stuff.
Yeah. Well, the Reno clinic, like I said, has been really busy. I actually looked at my schedule for this month to see how many arches I had, and I'm doing 19 arches this month, which seems to be pretty normal for the location. Looking back at the data over the last few months, that's like an average number. And I think we have capacity to do even more because currently we're only doing one surgery a day. So I'll have surgery Monday, Wednesday, Thursday. We'll do a single or a double arch. And then Tuesday, I'll have all my follow-ups and restorative work. And we have the team dialed in now where we're finishing a case very quickly and we're twiddling our thumbs for half the day. So we're ready to start adding on more cases each day. And I think that number could grow from 19, 20 to 25, 30 cases a month. And there's definitely the need for it here. There's a lot of patients who need full arch treatment. So really it's been settling into that. And the nice part about doing so many cases is when you're thinking about your first case, like it seems very daunting, but now these things are just routine. And so every day I show up to work and it just feels like another day at the office, right? Nothing really feels difficult to me other than if there's a challenging patient to work with, because in Reno or in Nevada, rather, we can't use CRNAs. So that is a challenge, is keeping the patients comfortable, but it's led me to pursue more higher education. And I recently finished my second IV sedation course. So it's something we'll be doing in the office soon. And I think that will just help the treatment be that much more comfortable for the patient. Like, I think that